Michael Patil, President and founder of the Fatty Liver Alliance here in San Antonio, Texas at Your Liver, Your Health. Two very famous people, Dr. Alkhouri and Dr. Patil. And we just had a really great evening, great presentation, by the way, great Q&A from you, Dr. Alkhouri. So what do you think about, first of all, the questions that people are asking? Because obviously there's a lot of curiosity about liver disease in general, right?
Yeah, I think that people have a lot of questions. They want to know what they should be focusing on in their liver health, and they want to know about their particular situation. They want to know what to do. So they're actually asking for counseling in these sessions, really, right? And so I think it's really positive, and I thought everybody was really engaged tonight.
Yeah, I couldn't agree more. I think we've done these programs throughout the nation now, and the same topics keep coming up, right? Yeah. How much, soda should I drink? Is it safe for me? How about alcohol intake? We get questions always about acetaminophen, Tylenol, questions about supplements, cleanses, and then when I'm told I have fatty liver disease, what should I do? How do I know how bad it is? So I think this is good to see that we need to do more and more of these events to educate across the nation, because unfortunately all these misconceptions about liver health are still out there, and we need to really educate the general population and also primary care physicians and doctors that take care of patients with diabetes and metabolic syndrome.
I wonder if patients aren't getting the feeling that they're getting enough love from their doctors when they're seeing their primary care, because primary care, they're so busy with so many people and so many things, and I get the feeling like they're starving a bit for information now.
I do too. I think that the visits are fast. There are a million things that primary cares have to do in 15 minutes.
And you can only bring up one issue.
They can check all the boxes, and liver disease, unfortunately, sometimes falls to the bottom of the list. But I think part of it is the patient being empowered. And I think when they are able, I had a patient, come up to me and say, look, is this the way I calculate my FIB4? Here are my numbers. So if they have some empowerment in bringing it up in the visit, in the 15 minutes, I think, we can get that secondary testing that they need. And I also think on the physician side, right, it's finding those ambassadors, maybe the PCPs who are more interested in really re-stratifying their patients.
Well, thank you very much. I'll just end by saying like this: if you were going to give a message to people, what's the one thing that they should do right now?
I would say know your risk factors, and know your risk scores.
That's a good one.
I would say, if you have type 2 diabetes, if you have cardiovascular disease, ask your doctor about your liver health and say, I'm at risk for fatty liver disease. Do you know if I have it or not? If you've been diagnosed with fatty liver disease, you need to know the severity of the disease. What is the stage? Because we have medications today that can reverse the disease and take you from, let's say, a stage 3, fibrosis, scarring, to a stage 2. And it's really a missed opportunity if you don't know if you have fatty liver disease and the severity, and to be able to receive the treatment that can reverse your disease. So things have changed a lot between 2023 and 2026, and now we have 2 FDA approved medications. We have more coming potentially next year, and we also have clinical trials with medications that have shown amazing efficacy. So utilize clinical trials if they are available in your community, because they are a great way to get excellent health care and also advanced medicine and science.
You both had really good advice. So I will just say this: remember, it's your liver, your health, so take care of it.